We are live. So we're still setting up here. John is setting up his audio. So give us a moment, but hello.
Okay, can you hear me?
Yes.
Yeah. Okay, well, welcome. Thank you. I think we're gonna hear first from Keith. Really, it's an honor to be with you, and I think we have a really interesting and unique program tonight. Basically, as we all know, the Oregon legislature just decided to repeal one of the most progressive pieces of drug policy that the United States has ever seen, Measure 110, which is the drug decriminalization initiative that was passed by Oregon voters in 2020. So tonight, this is really just kind of an opportunity for the psychedelic community to respond to and to react to this development that many of us are really upset about. So it's in the media conversations and the political discussions that led up to this event here, there was really no meaningful consultation with anyone in the psychedelic community, so far as I'm aware. And I've talked to quite a few people about it and have yet to have any understanding about there being input from psychedelic community or psychedelic perspectives on this recriminalization effort that just happened through Oregon House Bill 4002. So tonight's program is really intended as a chance or an opportunity to hear from people from across the psychedelic community about this development, really to help kind of develop the public discourse and the narratives around what drug decriminalization means and what drug recriminalization means from the psychedelics community. And of course, we don't exist in a vacuum. We're a part of a much bigger organization and a bigger landscape that includes things that aren't psychedelics, which are also very important. But the psychedelics perspectives were really omitted from that whole conversation. And so the hope is that we can help to fill those gaps tonight with a number of really excellent speakers. So I'm going to pass this. I'm going to keep talking. We're really blessed to have some really tremendous people here on deck today to share their thoughts, their reflections, their hopes, and their fears about what HB 4002 means for the broader community. First, we're going to hear from somebody who probably needs no introduction in this room. David Bronner, CEO of Dr. Bronner's, is going to be first up because he has to hard stop at 6:30. So we want to make sure we give time for him to speak his truths here tonight. David Bronner is the Cosmic Engagement Officer or CEO of Dr. Bronner's, the family-owned top-selling natural brand of soap in North America. The company caps executive salaries at 5 times the lowest paid fully vested position and donates all profits not needed for business development to causes and charities they believe in. David graduated with a degree in biology from Harvard in 1995, and by the end of that year, had his heart and mind blown wide open by psychedelic medicine while living in Amsterdam. Ever since, he's been dedicated to the responsible integration of cannabis and entheogens into American and global culture. He joined the board of MAPS in 2015. In 2019, he launched the nonprofit cannabis flower brand, Brother David's, to support Sun and Earth certification of cannabis grown under the sun in the soil without chemicals and with fair labor. He also serves on the board of the Regenerative Organic Alliance, which promotes regenerative organic agriculture and ethical dietary choice to support a more humane, sustainable, and fair farming system worldwide. So without further ado, please welcome David Bronner.
Yeah. Right on. Thank you, John, and Portland Psychedelic Society and everybody. It's a really a disappointing moment. Really, we were a major backer of Measure 110, and Yeah, I know you guys are going to be really unpacking all this. But even before the repeal here, there was still a policy hole in the landscape there in Oregon that we've been wanting to support helping fill and complete. Measure 109 with the regulated access program, we very much believe that we do need a regulated access program. It needs to be as equitable as possible. But for the majority of the psychedelically naive population, like our parents, generally speaking, for example, to avail themselves of the healing these medicines provide, they need to see that well-regulated access point to feel safe. But, with regulation comes cost. And I think we're all cognizant of the price tag on accessing, even in a group therapeutic model under 109 is, running at about $1,000. I'm on the board of the Sri Eckert Foundation, along with Tom and Nathan. We're hoping to raise $1 million to help subsidize, clients, BIPOC, LGBTQ, indigent folks to be able to avail themselves of this healing, as well as sponsor scholarships to make sure we do have a diverse, roster of facilitators that, everyone in our society feels comfortable accessing. But these are, and then also hopefully at some point we'll be able to demonstrate the efficacy of psilocybin therapy for alcoholism and end of life and depression and all these other things that then we can get Medicaid to cover. But that's uncertain timeline, and how much and when. And we absolutely need to also have home grow and the ability to sit with each other and to take medicines in community, self-regulating community, both secular and religious. And so we're, to that end, initially we were supportive of the Plant Medicine Healing Alliance, but just, really recognizing that Portland Psychedelic Society is the main anchor community point organization there. We've decided to make a grant available to PPS to build out a C4 organization to be able to run a ballot measure in Portland to decriminalize medicines for, as I said, home grow and self-regulating community use. We're also supporting Rhizome as a real great example of self-regulating community on the secular side, and then also Sacred Garden Community, which is a really awesome entheogenic church and one of the anchor churches in the Sacred Plant Alliance, which we're also supporting, which is a consortium of responsible entheogenic churches coming together to share best practices and, good facilitator training and good safety screening protocols and escalation protocols and legal posture as far as being legal under the federal Religious Freedom Restoration Act. And, we were hoping that this election cycle, we could help make this happen, but just the realities of the blowback with 110, it's just too uncertain. And anyways, we want to just give a long runway for these awesome organizations to really, set up shop and show what, just show everyone in Oregon what good self-regulating community use looks like, and be able to have a, really robust, largely volunteer-driven signature gathering campaign. We very much just want to support this and make sure this feels, that the local community there has ownership in this. I'm not tied to any particulars in the policy beyond the, very high level, I think, goal that we all share here of allowing for home grow and self-regulating use. And then also in deference to the Native American Church and other indigenous leadership, leaving peyote out of the equation. So, gosh, this looks like such a great lineup, and I'm sorry to be able to have to miss all the awesome speakers coming after me. But have an amazing night, grokking everybody's downloads. And look forward to getting up there before too long. and meeting a lot of you personally. So thanks for having me.
Thanks, David. It's really great to have you with us here. Yeah. Thanks for all that you do for this community. Okay. So there was a device that we had. Mike, are you around still?
Yeah, what's up? Yeah, your camera seems to not be working.
It shows on our end that it looks like it's working just fine. Is it? It's not showing on your end?
Yeah, on the stream, it's just stuck on this person staring at us.
Oh, wow.
I don't have any way to control it. That would have to be your camera.
The thing that's coming through StreamYard on our side looks pretty good. Looks like it's what it's supposed to look like. But okay. Well, okay. Well, this is a new program, and we're all learning here today. So learning is started. Okay.
Yeah, I just tested it again on my side. It is still just showing that for me. I don't know why it's showing the correct thing for you, but not us. But the internet needs to see your screen more than the people in the room can still see the screen. The internet needs to. So are you able to turn your computer or your webcam?
Yeah, we could actually. That makes a lot.
Or did you already try that and it's just not working?
Yeah. The thing says somebody in the audience out in the Etherland is saying the video has been removed by the uploader. So I don't know what that means, but
They try removing you and adding you back in. Yeah, see, now you have no video at all. Did you turn your video off somehow? Is the next question.
nope. Let's try. Okay.
We can still show your slides. It's just we're not going to be able to see if someone's presenting something that's not through the computer. We're not going to be able to see it online.
Okay. Well.
They can figure it out on their
Oh, sorry,
end.
Angela, I couldn't hear you. Did you have a suggestion?
I was wondering if you would like me to jump in so that they can spend some time figuring things out on their end, and then we can come back around when things get figured out with the video. It's an option. Just wanted to put it out there.
I sure like that idea. John, you hear that?
Yeah, Mike, can you see us?
No, it's still you're just a black screen.
Weird.
That's a Zoom thing, I think.
Yeah. Well.
And you were
Yeah,
using
yeah, Angela,
using a webcam, or were you using the camera attached to your laptop?
we're using the webcam, so maybe we'll just put the laptop on the podium and just do it like that.
Yeah, could you maybe
Angela, if I'll go, let's just go to you while we continue.
John,
Yeah.
we'll do that, but try disconnecting the webcam and connecting it again, and then maybe just try using the camera on your laptop instead and just having it set up close to you. But yes, I will switch to Angela doing the audio now.
Okay, so I've got Dr. Angela Carter, they, them, is a white, gender, and neuroqueer disabled naturopathic physician, educator, midwife, prison abolitionist, harm reductionist, and health justice activist. Dr. Carter is the current chair of the Oregon Psilocybin Advisory Board, drawing from experience as a lead medical volunteer and peer supervisor with Black Rock City Emergency Services, Queer Dome, and Fireside Project, and from their training in psychedelic peer support through Zendo and MDMA-assisted psychotherapy through MAPS. Dr. Carter was a program manager for the Oregon Health Authority for Oregon's ballot measure 110, Substance Use Decriminalization and Recovery Program, through the initial implementation year. Dr. Carter is the co-founder of the Marie Equi Institute, a nonprofit queer and transgender health advocacy organization based in Portland. Dr. Carter, it's delightful to have you with us today.
Thank you for inviting me. Can you hear me? Oh, well, thank you. So probably a lot of you know me from the Zooms. I've been serving on the psilocybin board since 2021, and I served as the program manager, as John said, for Measure 110 for the first year of implementation. I won't go into detail about my exit from OHA here because it was just not enough time. If you're interested in knowing more, there is an article in the Lund Report from August of 2023. I want to start off saying that I do not speak for the Oregon Psilocybin Advisory Board or Measure 109 or 110 programs at the OHA. I am no longer employed by the OHA. I am speaking for myself today. And I want to share a little bit about my background, just so you can have an understanding of the anti-oppression framework that guided my choice to take on managing the Measure 110 program for the first year of development. I have had a personal mission for the last 30 years to serve and uplift marginalized communities. I am a member of multiple communities that face marginalization, and because of my own experience and seeing that reflection of marginalization in my communities, I really wanted to improve things for folks. I've worked as a volunteer physician at Outside In Clinic, at Mercy and Wisdom, at OHSU. I have trained healthcare providers in culturally specific trauma-informed healthcare through the Oregon Health Plan, Multnomah County Health Department, the Oregon Sexual Assault Training Institute, Columbia University, Naropa University, and a lot of other organizations and medical schools with the intention of removing as much oppression from healthcare as possible. I co-founded a trans and queer health access organization in Portland. It's called the Marie Equi Institute. So I'm just sharing that with you to give you the framework of understanding why I chose to enter this work. In my work with marginalized communities, substance use disharmony has been a common and prevalent theme for a lot of people because substance use has a really strong foundation in poverty, discrimination, and lack of access to resources, which stems primarily from systemic oppression. And in providing care for my communities over the last 30 years, I've recognized that people use mind-altering substances primarily for two reasons: for the reason of exploring consciousness and or to mitigate the pain of trauma and marginalization. But really, these are two faces of the same coin. The goal for both is to seek freedom from oppression. So in my work, it became very clear that putting people in prison for seeking liberation is not only just diametrically opposed, it doesn't work, and it's not appropriate for managing mental and spiritual health concerns that are a culture-wide disease. It's a disease of culture, it's not a disease of the individual. The primary purpose of prisons is to maintain control and to concentrate power, not to help people find freedom from oppression. So in working to implement Measure 110, I saw an opportunity to make a real change in healthcare and carceral systems that have, despite a lot of very good faith efforts, consistently failed the communities and the people that I've cared for. So Measure 110 has taken a lot of hits from special interest groups who are seeking to return to these failed carceral policies that we have had for the last 50 years that truly fault the struggling individuals for systemic failures. But I do not see Measure 110 as a failure. It is not a failure of the measure. It has granted hundreds of millions of dollars that have funded positions for hundreds of new providers to offer critical mental health and social support for some of our state's most marginalized and vulnerable people. It's enabled organizations across the state to provide holistic support for people struggling with the pain of oppression, to greatly expand their services. And it's offered substance use treatment, housing, peer support, harm reduction, supported employment, and hope to thousands of people across the state, many of whom had no access to any kind of help before the program began. Measure 110 and Measure 109 together have also created a cultural shift in destigmatizing substance use. In the long game of politics, for sure, the passage of House Bill 4002, which recriminalized substance use and took funding from Measure 110, substance use treatment, to give back to law enforcement, is a big step back in the goal of increasing autonomy and freedom in the body and the mind of the people in our communities. But the impacts of this community and this program will continue to ripple forward for years. Even though we are looking at recriminalization, Measure 110 is going to continue serving our communities and improving the well-being of people struggling with harmful substance use. It's not over. I really want to emphasize that. We are not done here. Measure 110 has been the subject of a lot of criticism and sort of deemed a social experiment doomed to fail, and really scapegoated for all of the ills of society that were largely a result of the pandemic. But the fact of the matter is that we have not even had time yet to see the full impacts of the program and its funding on our state. And even if we had, the data collection system in place is a skeleton and is not sufficient to provide a clear understanding of the effects. Briefly, I'd like to just dispel some myths that are commonly used to skew public understanding of the program. What is clear in data is that Measure 110 has not increased overdose deaths in Oregon. Overdose deaths began to rise with the COVID pandemic, and they rose across the nation. There has been a well-designed study published in the Journal of the American Medical Association of Psychiatry, December of 2023, that found no association between Measure 110's decriminalization and overdose deaths in our state, or with legislation that occurred in Washington and overdose deaths in their state. So it's just not correlated. It has also not increased homelessness or homeless encampments. It has not increased crime rates. It has not increased unemployment. What has impacted these things is poverty, economic recession, chronically overburdened and under-resourced social services systems, and other stresses that the COVID pandemic had on our systems of government. COVID showed the cracks in our already faltering systems, and we cannot blame Measure 110 for these results simply because they coincided in time. Recriminalization of substance use is truly an egregious error that is going to cause a great deal of harm to many people. Putting people in prison for substance use limits our freedom and autonomy. It obliterates equity. It primarily impacts Black, brown, queer, transgender, disabled people and their communities. It destroys communities and families by caging entire generations. It reinforces the narrative that marginalized people suffering from oppression-related mental health concerns are disposable, and that poverty and trauma and oppression are the fault of the individual rather than a failure of the systems of governments to provide adequate and equitable support. It thieves us of our opportunity to practice our spiritual beliefs in the open. It hinders research and knowledge building related to mental health improvement through psychedelics use, and it stigmatizes the expansion of self-understanding and empathy and creativity. I want to be really clear that recriminalization of substance use through the passage of 4002 is definitely a hindrance to justice and liberty. But again, it is not the end. It is crucial that we collectively continue to push forward in our work to decriminalize psychedelics, but it is really important in doing so to remember that we have to not take on the false narrative of psychedelic exceptionalism, which is a belief that some drugs are inherently good and some are inherently bad. I said earlier, substance use in all forms is a means of seeking liberation from oppression. In using substances that have a higher risk, it may be that that is allowing that person to live to see another day. They may have no other opportunity to access the support that they need in improving their mental health, improving their life. Really, a primary divide in the stigma in our culture around the use of psychedelics to explore consciousness and the use of other substances to ameliorate pain is based in privilege, and people who do not have the privilege to access appropriate mental health and substance use recovery support because of their marginalization deserve the same opportunities to be free of oppression. If we're going to seek to end harmful substance use in our community, in our culture, in our body politic, we have to remove the barriers to cure and treat the cause. We have to end oppression itself and not punish people seeking relief from the pain of that oppression. We have to demand data justice from our political leaders. The legislative choice to recriminalize was based largely on intentional misinformation and political pressure rather than solid and complete data. The data systems that were designed for Measure 110 by a team of experts in the field of substance use treatment and policy and data design, they took 9 months building this data collection system. It was actively dismissed by OHA and leadership, and the data collection that was actually implemented did not even meet the basic requirements outlined in law in Senate Bill 755. If we don't have adequate data, we can't know the breadth of this program's impacts. The decisions that are being made based in spin and special interest lobbying, not based in the well-being of our community and complete data sets, facts, and reason. We also have to demand political transparency and accountability. The Measure 110 program was really hobbled by a lack of access to very available but completely inaccessible resources and staffing, silencing and obfuscation within the organization, and communication blocked between the organization and community agencies, and power hoarding. Voter-led ballot initiatives that are approved by the people of Oregon should not be allowed to languish unsupported if those in political power do not wish to endorse them. If our goal is decriminalizing psychedelics, and if the goal of that is collective liberation, we have to focus our efforts on decriminalizing all drugs, keeping disenfranchised people out of prison, providing treatment and support and hope, a reason to want to recover to all who need it to heal from systemic oppression. That's what I got to say. Thanks for listening. I appreciate you all, and keep up the good work.
Thank you so much, Angela. Okay, maybe this is a slightly better situation than we had before.
Can see you now. It's good.
The one behind you.
For the crowd.
Okay, thank you. All right. So I think all right. So next, Mike, did you do we have Anthony's slides available, Mike?
Hey, John. I just messaged you that I'm unable to add slides for you. So You need to either add them or share a PowerPoint. Probably sharing a PowerPoint if you have them is the fastest, easiest way to do it.
Got it. Okay.
Sorry about that. I was hoping I could, but I can't.
No problem. Okay, so next up, we've got another speaker here. Anthony Johnson is the president of Duff Johnson Consulting. He is a political consultant who was a criminal defense attorney in a previous life, a longtime drug policy reform advocate. He has over 20 years of experience working on successful policy changes. He was instrumental in the passage of 3 statewide ballot initiatives here in Oregon, serving as chief petitioner for Measure 91 that legalized adult use cannabis in 2014. He was communication director for the Measure 114 gun safety law that passed in 2022. And most pertinent to our discussion today, he was a spokesperson and co-chief petitioner and a deputy communications director for Measure 110. He prepared some slides today, and I'm not sure if we're going to be able to make these work, but we will do our best. And without further ado, let's invite to the stage Anthony Johnson.
Thank you so much, John. Angela and David Bronner, of course, tough to follow. Let's see if I can do. You know this is going to work?
People on the live stream won't see those.
People on the here, will people here see this?
Yeah.
Well, let's do that then. Johnson. Who said that? Gonna work or no?
Oh, there you go.
There we go. All right. Thanks so much, everybody. My name is Anthony Johnson. As John said, thank you for joining all of us in this gorgeous day in the People's Republic of Portland. And seeing these smiling faces, seeing like-minded people, hearing from someone like Angela Carter, really heartwarming. And it's a fitting that it's such a beautiful day today because despite everything, it is a great time to be alive. And the future of the psychedelic medicine community is very bright. Don't let the good Asian genes fool you. I have been at this fight for more than 2 decades, and I've seen us have a lot of ups and downs and all these obstacles that we face. We've been here before. So here's me back in the corner here, stirring the pot back in the day that you really loved pot puns whenever you worked on anything. So MU students lead effort to alter city's view of marijuana use. I thought that once people in Columbia, Missouri heard my brilliant mind speak, they decriminalized marijuana, no problem. Well, I was wrong. Voters smoke pot proposal. We got about 42% of the vote. And that was a tough one. But we come back stronger than ever. Marijuana measures pass handily the very next year. All right, come back and win. You just get out there, you get talking, you inform people, people get educated. Sometimes you got to lose before you win later on. Happens all the time, all kinds of movements. Our movement, no different. People think that it's been oftentimes it's been an easy road to legalize cannabis in Oregon. Not true at all. I was chief petitioner of Measure 74. Oregon voters reject medical marijuana proposal. That would have legalized dispensaries, would have provided free medicine to low-income patients. We got about 43% of the vote in that measure as well. But not deterred. We come back and win at the legislature and legalize medical marijuana dispensaries next year. Fast forward 2014. Hey, Anthony Johnson, somebody made a difference in 2014. Chief petitioner legalizing cannabis. And then what do you know? I go back to Missouri. Leader of Oregon's marijuana movement sets sights in Missouri. We legalized cannabis in Missouri. Spoiler alert. You know? And then Measure 110, landmark bill, really like a culmination of my life's work. Passed 58% of the vote. Had no idea we'd get that big of support. We never polled that high. Never in my wildest dreams would we think that we'd win with that much support. And then COVID, fentanyl, homelessness, like blamed for just everything. And then Oregon's drug decriminalization experiment appears dead. And why is it dead? Is it because, must be because Oregon, our overdose death rate must be the highest in the nation, right? Oh no, it's West Virginia. I didn't know West Virginia passed Measure 110, or Tennessee, or Louisiana, Kentucky, Delaware, New Mexico, on down the list. We're not in the top half of the nation, but yet Measure 110 blamed for everything. Oregon Senate Republican leader passing this bill will put Oregon on a path to recovery and signifies an end to the nationwide decriminalization movement. I call that a victory, he says, when he passed House Bill 4002. And what happened at the legislature, in my opinion, it was fentanyl. That's all there is to it. There was a fentanyl crisis across the nation. When we were writing Measure 110, fentanyl wasn't an issue on the West Coast. I remember talking to people, even people who were in the drug reform community who use drugs. They're like, you're not going to really decriminalize heroin and meth, are you? And I was like, yes, we do not want to criminalize people, take away their livelihood, take away their agency. We want to give them the resources to overcome their addiction, their substance abuse issues, as Angela Carter said. All right. But fentanyl was a different beast. And I think that's something that personally, I think we got to grapple with. Fentanyl is the addiction rate, the overdose rate. It's something I think we had to be realistic about. And I think at the legislature, it was a given that fentanyl was going to be recriminalized. There was just no way we were going to escape without recriminalizing fentanyl. Heroin and meth will probably be recriminalized too, but definitely fentanyl. And I think that the movement was caught a little flat-footed by being naive in that respect. And I think personally, we needed to compromise and say, hey, we have a fentanyl crisis. Yes, we need to deal with that. But if we have a fentanyl crisis, why are we going to waste resources going after people who are using psilocybin mushrooms, who are using DMT, or using LSD, other psychedelic medicines, right? And we could have protected that aspect of the law, in my opinion. But there comes opportunity and light at the end of the tunnel. Even Oregon Health Authority put out a news release today. Measure 110, new client engagement, highest quarterly gains in substance use treatment, a 400% increase in people seeking employment services, over 300% increase in people seeking substance abuse treatment. The gains that we're going to have are going to be shown over time. And where we go from here, personally, I think we got to go back to the people. Step by step, city by city, county by county, legislator by legislator. We have a great opportunity to decriminalize psychedelics here in Portland, Multnomah County. Any city, county that has a citywide initiative, take it to the people, step by step. Once again, the truth will be revealed and the truth will set us all free. And so the people that say our movement is dead, I say, reports of our demise have been greatly exaggerated, and we'll be back stronger than ever. Thank you, everybody.
Thank you, Anthony. Next, we have with us Nicole Rooney. They go by they use they them pronouns. They are an undergrad student in the Dorothy Day social work program at the University of Portland. They are also a policy organizer at Unite Oregon, a statewide nonprofit led by Black, Indigenous, people of color, refugees, immigrants, rural communities, and people experiencing poverty to build a unified intercultural movement for justice. In their role as policy organizer, Nicole has been focusing on reimagining community safety and economic justice, And the bulk of their lobbying work in 2024 has been on protecting ballot measure 110 and lobbying against House Bill 4002. It's my pleasure to introduce to you Nicole Rooney.
Awesome. So I'm really excited to be here. My experience is a little bit more limited than the other folks, especially in terms of kind of the psychedelic space. But like John was saying, and I do really want to echo what Anthony and Angela were saying. So I'm going to kind of talk to a little bit about my experience working in the legislature, directly lobbying legislators, as well as talking to community members and figuring out kind of like what their interpretation of kind of the situation on the ground. So to start, I guess, to provide a little bit of context, so the state of Oregon, depending on kind of where you get your data from, ranks 48th to 50th in terms of access to treatment. And so, we came at this problem starting from, below ground zero. So Measure 110, the people voted for that. The intention to get people into treatment, to reduce the stigma, all had, the measure itself was written really well. But like Angela was really saying, and I really appreciated their perspective as someone who was part of the implementation process, it was not supported by the people who were supposed to implement it in so many ways. And one of the biggest problems was law enforcement. I did a lot of my undergrad research on Measure 110, how it was repealed, how we went from, the most progressive drug policy in the U.S. to, not back to the full war on drugs, but pretty bad. And a lot of that was law enforcement. Law enforcement was not trained in kind of their role in Measure 110. And so they were kind of left thinking that they were floundering, that they had no role in it. And it turns out that they were one of the hardest lobbyers in support of 4002. So a lot of the hearings, the Joint Committee on Addiction and Community Safety Response, who brought the bill to the legislature, the testimonies were mostly from law enforcement, and also, unfortunately, people who had experienced either a loss of a loved one because of an overdose or addiction, and that becoming like, right now it's all carrot, no stick, right? So like there's no incentive to get treatment. Which, yes, that works for some people. Some people need to hit rock bottom. Some people maybe need to go to jail in order to hit that point. But the problem is that Oregon has been woefully underfunding housing, the basic needs of people. And so, of course, people are going to turn to drugs. And of course, people are going to continue these maladaptive, behaviors in order to survive under an extremely oppressive system that doesn't want to see their success. So a lot of the comments from the legislators that we spoke to, and for context too, there were only 9 legislators who actually voted no on House Bill 4002, despite the amount of public outcry. Myself, through Unite Oregon, the ACLU of Oregon, Health Justice Recovery Alliance, Partnership for Safety and Justice. There were so many of us who showed up. We mobilized our members to show up and go to the legislature, and they still didn't listen. And on top of that, like Angela kind of echoed, there was also so much data, despite only there being 2 years of data collection. None of it indicated that Measure 110 was guilty for any of the things that they were trying to correlate, and they were seeing more people getting into treatment, more people getting the help that they needed. And I wanted to touch on another part of it too. So I think like turning it to people is exactly what we need to do, but we need to do a lot on our part, just as advocates for drug reform policy, of really like having one-on-one conversations with folks. Because what I found in a lot of these conversations was that that stigma around drug use is still so deeply culturally ingrained. Doesn't matter what kind of drug it is. Like Angela mentioning the psychedelic exceptionalism, I think is incredibly important, because right now, to most people who are are removed from these spaces, they don't see the differences between these drugs. They just see, they equate drugs bad, and that's that. And so like we have a lot of work to do in terms of kind of shifting that narrative, and really helping people see why it is that people use drugs, why it is that people, end up making these decisions, and also that it's not harmful. And like, nobody wants to talk about alcohol, but that's another thing that we need to bring into the conversation. As someone like, I'm a drug user. I, lost family members to drug use and alcoholism. My mom, I lost her to her coping mechanism of using alcohol. But we as a society are not ready to talk about how that for some reason this thing that we don't call a drug is okay and legal, and we have safe consumption sites for them. They're called bars. So I could talk about this for a long time, obviously, but there are so many other great speakers that I want to leave the floor to. I think I just want to leave it on that the fact that there is still a lot of hope. I think there is still a lot of work to do. Measure 110. A lot of it is still intact. So the funding that's meant for treatment and the burn or the behavioral health resource networks, that is still being sourced out to people. The biggest problem is that with the recriminalization, we're kind of taking a step back in terms of breaking through that stigma, allowing people to ask for help. We're going to see more people imprisoned, and of course, coming from an organization that our members are mostly BIPOC, I need to mention too that like this is directly harming people of color. And it always has. We know this, that the war of drugs or war on drugs was started as a war on people of color. And that is continuing to happen here. Oregon has a very long history of racist policing. And I could go into more detail about House Bill 4002. I would be happy to answer questions about it. But basically, it's leaving it up to the counties to actually offer deflection programs. They advertised it as this thing that was like, we're offering so many off ramps. People aren't actually going to go to jail. But in reality, it's pardon my language, but it's bullshit. Yeah, I think I'm going to end it on that note. But like I said, I think there is a ton of hope still, but there is a lot of work that needs to be done, both in the legislature and outside of. So, thank you.
Thanks for that, Nicole. And next up, we have somebody who around here certainly doesn't need any introduction. We are lucky to have with us the president of Portland Psychedelic Society, Keith. Keith Gilmore is a writer, speaker, and coach. He writes and speaks on matters of culture, ethics, psychology, spirituality, philosophy, and psychedelics. He is the president of PPS, a 501c3 nonprofit in service of psychedelic education and community building. Keith, welcome to the stage.
Hey, friends. All right. So I am not going to speak on the political situation that we find ourselves in. I want to speak to the existential situation that we find ourselves in, because I believe it underlies all of the maladies that humanity is facing. We do not have time anymore. We do not have time to keep dallying around, playing politics when people's lives are being destroyed. When the political decisions that are being made are at the expense of human flourishing. We don't have time anymore. The world is on fire with sorrow. The earth and her people are crying out. We don't have time anymore. So to be faced with the situation we find ourselves in of making the stride forward and having it pulled out from underneath our feet, without giving it due time to see how it transpires, it is inhumane. And what I want to speak to is how the drug crisis that the state and the country is facing, and the homelessness crisis that the state and the country and the world is facing, these are direct symptoms of the greater spiritual and existential crisis that humanity is facing. These are symptoms of the spiritual crisis. Our people are literally dying due to anemic leadership and myopic vision. It has to stop. And to be clear, I don't blame anyone. I'm not here to blame anyone. Blame is, we're all swimming in the same sea of culture that has collected the detritus of history, and these cultural systems have their own momentum. We're all in it. And to be the doctor in the cancer ward pointing their finger at someone and saying, well, you were eating Doritos and Oreos every night, so deal with it. It's not the proper stance. We have to have humility and compassion, even with people who don't know what they're talking about, like this guy, whoever that Anthony put up, the Senate Republican majority leader, who I read the little quote on his statement that said, "I am proud to be on the right side of history." Are you sure? Are you taking your medicine? It is legal in this state to take mushrooms under the Measure 109 framework. Are you taking your medicine? Are you sure? So at the same time as I don't think blame is the appropriate stance, we also can't use that as an excuse to not take our utmost effort to transform the situation that we're in. To say that psychedelics and methamphetamine and heroin and fentanyl are the same is preposterous. There is scientific evidence, research from the 1950s showing the efficacy of psychedelics for anti-addictive properties. This is well beyond established. It's well beyond established. So on the one hand, we're saying, okay, we need to outlaw drugs because look at how much of a crisis this is. This is an emergency that we're facing. And on the other hand, we're saying these category of substances that are the best tool we have to fight addiction, to ameliorate the causes that lead to addiction, these are the same, and they have to be outlawed too. It does not add up. And anyone who has tapped into the mystery of psychedelics understand their potential for addressing all manner of cultural, personal, psychological, physiological maladies. We don't even know. So we're being led by people who have not tapped into the mystery of the psychedelics. And again, I don't blame them. I don't think anyone should have to turn to this particular modality of understanding without being called. But can we afford to be electing leadership who don't have this important context of what it is to be a human being? And I think the importance of this context fundamentally is that the psychedelic experience shows us the reality that we are all brothers and sisters, the reality, and that any one person at all who is living on the street in a drug-addled state is a tragedy. Any one child who is dying of an overdose is beyond a tragedy. And so to punish people who are suffering from the sickness that our culture has imposed is preposterous. And I think that us as psychedelic people, I'm kind of preaching to the choir here, but the choir's duty is to sing. That's what the choir does. So let's sing loudly, because we do not have time anymore. So thank you.
All right. Now you get you all know who I am, right? You don't need an introduction. It's John Dennis. I'm an attorney in Eastern Oregon. I've been working on trying to make Oregon's drug policy as humane and enlightened as it can possibly be under the circumstances of the Measure 109 system that we have, and now the no longer Measure 110 system. So this is a lot of us are really upset about this, and we got here in a lot of different ways. A couple of acknowledgments to start. First off, we meant to do this at the very beginning. This day hasn't really gone according to plan. You might have noticed. Thanks for rolling with it. So there's no expectation of confidentiality in these spaces today. So just as a slight kind of warning. And then as a potential trauma trigger, opioids are an issue that really touch a lot of people in a really kind of deep way. A recent study by the RAND Corporation has shown that about 42%, almost half of all people in the United States personally know somebody who's died due to a drug overdose. So I think when we talk about the challenges of Measure 110 and what the search for the right solution is, or the best path forward is, we can't be naive to the fact that this is a real serious social problem. We can disagree about what the correct solution is, but anyway, this is just something that touches so many people, and it's something that I think a lot of us want to make light of it. And I think we really have to sit with this, and we have to own these problems if we wish to not be kind of have what happened, which is, it gets taken from us because of these problems. And if we don't take them as ours, then who else is going to? Someone that we don't really like the way that they approach these things. So I'm an attorney, but nothing I'm going to say here today is legal advice. And today's date is April 18th, 2024. This information is current as of today, but if you're watching the live stream or a recording later on, it may not be current by the time you get to it. So ballot measure 110, also known as the Drug Addiction Treatment and Recovery Act, was sponsored by the New York-based Drug Policy Alliance. The purpose of it was, written into the measure to make health assessment, treatment, and recovery services for drug addiction available to all people who need it and want access to those services, and to adopt a health approach to drug addiction by removing criminal penalties for low-level drug possession. So in a way, this law wasn't really initially addressed to the issues primarily surrounding the use of psychedelics. It was really primarily meant as a harm reduction for people who, often die or potentially die without safe supply, which of course does affect people in the psychedelic community also. But one of the things that I think we think about this is Measure 110 was a really blunt instrument that treated all drugs exactly the same. And so now with its repeal, it's really kind of easy to say cry foul when the repeal of it treats all drugs the same. And it's easy for us to say, our drugs didn't cause this. The ones that we use beneficially for our growth and advancement, they weren't the cause of this. Why, throw the baby out with the bathwater kind of thing. And again, this goes to taking responsibility and accountability for the broader ecosystem problems that we were talking about with respect to opioids and fentanyl in particular. So the beauty and the genius of Measure 110, from my perspective, is that it really tried to represent a major paradigm shift away from a punitive system to a more holistic care model of addressing the challenges of opioid use. And so, as probably everyone in this room knows, the way it did that was by removing the criminal penalties and really reducing it down to a $100 fine, a Class E violation, that you could have totally removed and written off if you were to make one phone call to a drug treatment screening hotline. So the idea was that it gets more points of contact to these services that could help people. And, that was its kind of, its grace. And the thing that it did, the way that it did that in addition is it also funded free treatment to those systems of care and recovery services, as Angela mentioned so well earlier. But the campaign from its inception was really pretty controversial. It got a lot of opposition from district attorneys and law enforcement who carry a lot of sway in political circles. And when it took effect in November, there was really not a whole lot of time to do education work, to create those systems of care and get them kind of up and running. It took effect just 3 months later, and with the expectation that the treatment centers are going to be open and operational in October 2021. We see the voter data from the 2020 election. So as you can see, the blue areas are the places that went in favor of Measure 110, and the kind of green areas went against it. And this is sort of an interesting kind of fact of this is these areas that were the most population dense, like places like Portland and Eugene, were the places that had kind of some of the downtown challenges of, drug markets, open air fentanyl markets that really ultimately were the, I think in some ways, the political death knell for Measure 110. So the people that supported it were also the ones that in a certain way experienced the kind of aspects of it that really ultimately led to its demise. So the question is, if back in 2020, it had 58% of the vote, and then by April 2024, 63% of voters favored a return of criminal penalties. How did that happen? How did we go from a pretty strong, even higher than Measure 109, people supported Measure 110. How did we go from that seemingly totally 180 just in the course of 4 years or 3.5 years? And so there's a bunch of challenges of implementation, as folks have spoken to. Angela Carter, Dr. Carter, they were the initial program manager. And, this article here from the Lund Report does a really excellent job of going into a lot of the details as to how OHA really didn't support them in running this program, which is what they said on their way out of the job after just a year. They felt unsupported. They felt, like that they didn't really use organizational resources to hire people and to start really distributing the money so that the services could really be offered. So that was a big part of it. And I am not probably the best person to speak to that. And then there's this other really great OPB article that I want to highlight here that was done with also ProPublica about really how all three branches of Oregon government failed and contributed to the shortcomings in this initiative, starting with the court systems. First off, judges not really being trained on it, law enforcement not being trained on it, the legislature not appropriating money fast enough. This really was kind of a major, kind of all aspects of this did not happen as it was intended. And that was, so when we talk about, was it a failure? Obviously it depends on who you ask. Some people have different opinions on this. But I think it's really unfair to say that this was a failure when, the state really did not go out of its way to ensure its own success. So one of the things in this OPB article that highlights really well is that during, right after 110 passed, people from the Drug Policy Alliance reached out to Oregon and specifically asked, here are some ways that we can ensure that this is effective and that it goes well. And the article kind of goes into detail about how all of those requests appear to be denied, and ignored completely, including things like when the law enforcement offers this $100 ticket. One of the simple asks was, you need to put on this ticket that here is a hotline that you can call with a point, contact point with the treatment services, and none of that happened. So this is sort of that side of it, of just the failures of implementation. And as Anthony spoke to, meanwhile, there's these other kind of trends between fentanyl and a lot of overdoses and a lot of overdose deaths. And then, these really sensational articles and probably, potentially accurate articles about just open air drug trafficking in the middle of downtown Oregon, which, might not be something that a lot of downtown businesses care to see kind of in their front yard, so to speak. So it really started turning the business community against it. And so then here, just in September of last year, we see this coalition forming that is going to propose a ballot initiative to undo Measure 110 and reinstitute criminal penalties. And touting some really high net worth donors, including Phil Knight, the richest Oregonian, as well as people from Columbia Sportswear and others, wanting to reinstitute criminal penalties. So I thought this was just kind of interesting. I won't spend a bunch of time on this, but on their website, the Coalition to Fix and Improve Ballot Measure 110, as they like to call themselves, they actually put some of their polling data up for all to see. And I think that this kind of helps to show kind of in a way, like the historic record of how things kind of had the backslide going the other way. And, in this data, they kind of asked voters, in Oregon, if it's illegal to drink alcohol or smoke cannabis on streets and sidewalks, but it's okay to openly use drugs like fentanyl, meth, and heroin in public, should Oregon immediately prohibit the open use of hard drugs in public places? When they phrased a question like that, 86% of respondents said yes, should do it immediately. Hindsight's 2020, and it's easy to pick apart something after the fact, after it's already done, and you can look back and say maybe that was been a political liability for the Measure 110 campaign, that they could have foresaw that public use would have become rampant in a town and a state like Oregon that has a pretty visible homeless community or houseless community, but they didn't do that, and that became kind of one of the main things that this measure became associated with. Here is, this doesn't have to be accurate. This is just public perception. But they asked whether Measure 110 has made Oregon's homeless crisis better, worse, or no impact. And 62% of people said that it made it worse. So the other thing I want to highlight here is that all of these conversations really focused on fentanyl, meth, and heroin. And while we don't engage in psychedelic exceptionalism, we don't say that some drugs are good and some are bad. We say, but they may not have the same risk profile or harm profile or addictive profile. And maybe there is potentially some way that they could be treated that doesn't just gloss over them and paint them all with the exact same broad brush. So when the coalition was attempting to rally against this, this says it right here at the top, it's lives are being lost, overdose deaths, and streets are unsafe. So it's overdoses and it's the homeless, it's the downtown. These are the two things really driving this repeal effort. And in their initiative, and I'm not trying to spend too much time on this, but their proposal said prohibit the use of hard drugs in public places, make drugs like meth, fentanyl, heroin a crime again, replace voluntary with required treatment. And it's these are not necessarily, none of these problems, to my knowledge and to anybody I've talked to, these have nothing to do with psychedelics. These weren't problems that were rising out of, use of psychedelics. So the question is, what they were going to do. So the ballot initiative that was coming down the pipeline with a lot of funders, that I think there was a recognition at the legislature that this was going to be hard, and if they didn't take some kind of action, that what was going to be handed to them through this process was going to be worse than something they could produce on their own. So then we see this kind of attempt by a couple of legislators to come up with something that I think they thought was going to be a lesser of the evils. Interestingly, both of these people, although they were Democrat, they were also prosecutors. And I think that also is a significant part of this. If you're leaving former prosecutors to draft drug policy, I think it's going to be very different than if it's done in a more community-based kind of format. But they did it in a short session. They didn't have time to really address the issues and explore them, the nuance that goes into this. And so I think it was a really rushed job. Interestingly, as they were going through this process, they did the Oregon Criminal Justice Coalition, when they released their racial and equity impact statement about how this law was going to basically impact things, they found, or they determined, that there would be a total of 2,200 new criminal convictions every year that include low-level drug possession charges. And out of those, 1,333 of them would be people that were prosecuted only for drugs, and they did no other crime. It wasn't that they were doing some other crime and happened to have drugs on them. It was just the drugs and nothing else that was that they're going to be able to cite them for. And of those, the measure has a bunch of off-ramps, as we talked about, not enough off-ramps, but ways that people can avoid conviction and jail time. The state's basically predicting that of those 2,200 or 1,300, depending on which category, that about 533 of them will actually potentially go to jail because of this. So that is really not acceptable. And, this OPB article, quote, says that lawmakers' actions are likely to reintroduce jail time for addiction and exacerbate some racial disparities in the criminal justice system. That shouldn't surprise anybody in this room. And also, we're in the middle of an unconstitutional public defense shortage, meaning there's not enough lawyers to, public defenders to take the cases and actually give adequate representation to people who might have good defenses. The other part of this that I haven't really heard a whole lot reported in the media is actually the fiscal impact of HB 4002. And for the biennium running from 2023 to 2025, meaning the legislative 2-year rotating period, the first one where it's active, they're actually estimating $22 million to recriminalize drug. And I should say, in fairness, all this isn't just prosecution. There's a lot of other money that's going out for other causes and task force and those sorts of things. So it's not all that, but you can see the breakdown of where the money's going. 12 million of it is to public defense lawyers that will have to do that. And what's even more shocking is if you go look at the next biennium after this, 2025 to 2027, they're saying for that period, it's going to cost $106 million. And of that, Department of Corrections is getting about 27 million. If that's not problematic enough, what's really also interesting is one of the main people backing the repeal or so-called fix Measure 110 campaign was involved with Oregon's prison system. And it was Oregon has, I should say, public prisons. We don't allow private prisons in Oregon, thankfully, unlike a lot of places. But anyway, that is, you see here just how much this is going to cost people. So when the vote finally came out, it wasn't really even close. It was kind of a landslide. Interestingly, with this, we saw people who were some people who voted no, either voted for it because it was really oppressive and inequitable, And there was actually some Republicans that voted against it because they didn't think it went far enough. So that's kind of this, we don't really see this happen very often in politics, at least not as much in Oregon. And then, of course, this article in Vox came out really just kind of, for the first time that I saw anywhere, media actually giving attention to the fact that this is going to have impact beyond just meth, fentanyl, and heroin. That psychedelics are going to be the kind of bystander, the casualty of this process. So that is the history in a way. And since we're running behind on time, I'll try to be pretty short on this second one. But this is kind of what the actual criminal risks that people may now be taking if they want to access controlled substances in Oregon. So essentially, the new thing that this law does is it creates a whole new kind of misdemeanor that did not exist previously, and to my knowledge doesn't exist anywhere in the United States, called a drug enforcement misdemeanor. It carries a maximum sentence of 180 days. And I'll say that Drug Policy Alliance, who, obviously was not excited to see their initiative kind of have a major backslide, they agree that where we landed was actually better than where we started. Like, we had misdemeanors before, and this really gives a lot of there is more flexibility. It's not enough flexibility, but it is there are opportunities to avoid it. In fact, Senator Kate Lieber, who was one of the two people driving this, created this flow chart that it's a lot of ways this can go, but essentially so the first thing that Nicole mentioned earlier was about these deflection programs. And in a way, this actually does empower some either law enforcement or prosecutors to not prosecute. And so if you're in a county or a city that you think that you might have people there that are favorable, you can reach out to your district attorney or your chief of police, and you can talk to them about these deflection programs and try to really engage with them and have these policy discussions and talk about what their deflection program is going to do, when they're going to use it, when they're not going to. But this actually creates kind of at its inception an opportunity for educating folks and really giving, having some vestige of leniency, which isn't enough, but it is something that I think there's an opportunity for advocates to make an impact in their communities with this. So this is the reality that we have now for the time being, at least. And so, why not try to leverage the opportunities that are here to make it less bad. So with the possession amounts, I think it's important for this community, especially the kind of psychedelic possession amounts that would be within this realm where you're basically guaranteed here. So even if you go to court, right, and if the DA or the police don't do the deflection, they still can only give you this conditional discharge, like they must offer it to you, which does not require jail time. In fact, it may not require jail time, assuming you comply with the conditions of the probation. So granted, probation is not a good thing for this, but it's may not go to jail if you comply with the terms once you have your first point of contact with the criminal justice system through this new law, and record seal, charges dismissed. So it's supposed to really reduce the impact, the negative impact that a criminal encounter can have on a person. So let's say at this point the person doesn't comply with probation and they have some kind of probation violation. Then it kind of goes to the next step of this, and then. Again, there's no legal ability for jail time which is still, I mean, I'm not saying it's good because it's not as good as where we were, but I think this is just where we're at right now. And this also includes an automatic expungement if the terms of probation are complied with. So it's only if you go through the third kind of step of this that jail is an option. It's even on the table. So I think for people that's the risk that we take now if we decide to possess controlled substances. And then it's up to maximum 180 days is the ultimate end of the line of this. So the amounts that would get you within this realm where you have several options before a court may impose jail, you have to be within the possession limits where that applies. And so for psilocybin, it's under 12 grams. So if you have 12 grams, you're going to be at the next level up and you won't have these guaranteed pathways to avoid jail. If you're at 11.9, then you're there. And there are some states that have laws that say if, I think Colorado's, it goes by the weight of the substance itself as opposed to the entire weight of the so for instance, like if you make a chocolate bar and it has 1 gram of psilocybin in it, but it's a 12-ounce bar of chocolate altogether, at that point, even though it's only 1 gram of psilocybin, you're at the weight limit and you're no longer in this drug enforcement misdemeanor category. You're at the next level above. So just to be very careful and attentive to that, because for a lot of people, that's not really a lot of psilocybin. Likewise with MDMA, under 1 gram or basically 4 or fewer pills, tablets, or capsules, or any mixture of anything containing any amount of MDMA. And for LSD, it's basically the law uses this term user units, but basically if you're 39 or fewer hits, you're going to be within that drug enforcement misdemeanor with, the court may not impose jail, at that point until there's several, probation violations essentially. And the interesting thing about this is that now these substances are criminalized again. Each one of these 3 substances has recently been given breakthrough therapy status by the FDA. Specifically LSD most recently for generalized anxiety disorder just within the last month or so. But this is the kind of the hypocrisy of the system. And to even drive this point even further, Missouri House, the House of Representatives in Missouri, just allocated or passed an initiative that would give $10 million of their opioid settlement money to fund research and psilocybin for opioid addiction. So to think that we're going to curb opioid addiction by criminalizing psilocybin is just, it's at odds with the science. Here are the possession limits for other substances as well. MDA or MDEA, sometimes called EVE. It's the same as MDMA. It's under 1 gram or 4 or fewer pills. And so if you're above those lines, then you're at the next step. You're no longer drug enforcement. You're now at a Class A misdemeanor, which has a maximum 1 year jail and maximum $6,250 fine. With no mandatory deflection for treatment. So that's the status of things. So be aware and be careful out there. And so I think, and then, just for the other part of this that's significant is they made it easier to prosecute drug dealers, essentially. And the way that they did that specifically is to change the legal definition of delivery. So it makes it easier so that if a person has a large amount under the prior system before this law, if you had basically a large amount, but you didn't have like a particular plan, you didn't know where it was going to go, you didn't have specific plans to distribute it, they couldn't necessarily capture you on a trafficking charge. At that point, these were called, Boyd delivery. So a Boyd delivery is where basically you have an amount, you don't actually intend to deliver it, but you have enough that you're probably not going to consume it all yourself. So the law kind of infers that certainly you must have intended to deliver it. And that's kind of what they're going back to, is this, you don't even have to have clear specific intent. It's like general intent to maybe move some time. When Boyd deliveries were basically overturned in the Court of Appeals, we saw an 82% reduction in the amount of trafficking cases that got prosecuted. So, if we go back to that, the reverse of that's about 400% is potentially the increase that we may see in trafficking charges that are brought in the state of Oregon. So, that's significant risk that folks ought to be aware of. And I think just one of the last things before we start transitioning to our next speaker is, the law, as we talked about, really was targeting houseless people. And they literally wrote into the law something that would elevate the amount of sanction that you receive if you are delivering controlled substances within 500 foot of a treatment facility, like a drug treatment facility. So targeting addicts now instead of really trying to help them, and also 500 foot of a homeless shelter or temporary residence shelter. You have a higher criminal sanction if you're caught, or 30 foot of a public park. So there's a couple of ways you can get involved. The measure also does create some task force and some things like that, where there is an opportunity for advocates to get involved in community drug policy making. And of course, if the good people, those of us who come at it with this kind of community-based perspective, don't engage with these systems, then they don't have the opportunity to learn from our knowledge and our experience. So I just always like to tell people, if get involved and stay engaged, because it really does make a difference and can. The last thing I'll say is with respect to religious use. So obviously, it will come as a surprise to nobody here that HB 4002 did not carve out any religious use exemptions for psychedelics. And of course, silent with respect to that. Oregon is the home of Oregon v. Smith, which is the U.S. Supreme Court case that basically said that if you're anywhere in the country, the First Amendment will not protect your use of a psychedelic sacrament or entheogenic sacrament. So, when we think about what, a fix to this might look like, the religious use issues are, still ever present. We actually do have a peyote statute that would, provide a defense, but for no other sacrament is there a potential religious use defense in the state of Oregon besides peyote. So thank you for that. And now, speaking on religious use, we are extremely privileged to have with us a very special guest who probably also needs no introduction here. Bia Labate is a queer Brazilian anthropologist based in San Francisco. She has a PhD in social anthropology from the University of Campinas, Brazil. Her main areas of interest are in the study of plant medicines, drug policy, shamanism, ritual, religion, and social justice. She is the executive director of the Chacuna Institute for Plant Medicines and serves as public education and culture specialist at the Multidisciplinary Association for Psychedelic Studies. She's also a visiting scholar at Naropa University Center for Psychedelic Studies and is an advisor to the Synthesis Institute. Additionally, she is Diversity and Inclusion Chair at Veterans of War. Dr. Labate is the co-founder of the Interdisciplinary Group for Psychoactive Studies in Brazil and editor of its site ever since. She is author, co-author, and co-editor of 25 books, including special edition journals and numerous peer-reviewed articles. Bia, do we have tech? Hello, Bia.
Can you hear me?
Yes, we can. It's wonderful to see you.
Okay. Hello, everybody. Thank you for having me here. Greetings from San Francisco, Ohlone territory. It's an honor to be here. I am the executive director of the Chakrina Institute, as he said, and Chakrina is a nonprofit organization, a 501c3, and we have three main programs. One that we call Indigenous Reciprocity Initiative of the Americas, which talks about reciprocity to Indigenous people and decolonial dialogues. And another program we have is called Psychedelic Justice, which basically means introducing discussions on race and gender in the universe of psychedelics. And our third program is called the Protection of Sacred Plants and Cultural Traditions. And we help empower the psychedelic community with resources for best practices and psychedelic churches to self-organize and create harm reduction towards the globalization of psychedelic plant medicines. Chakrina is also a partner to the Plant Medicine Healing Alliance, and I personally sit on the board of the Plant Medicine Healing Alliance. I am excited about our forthcoming ballot measure led by the Portland Psychedelic Society and the Plant Medicine Healing Alliance in collaboration with the broader psychedelic medicine community. I am firsthand witness of the joint collective effort for years to help pass a policy that protects the underground in Portland, and how this team has helped shape policies in other cities. I am deeply grateful that Oregon is looking for protections for the underground, and so sad, like many of us here, to see the regress and recriminalization of psychoactive substances. I'm going to take 1 minute to talk about prohibition. Unfortunately, we have to go back and back to this matrix. What we're seeing here now with the recriminalization of drugs in Oregon is the old patterns of anti-prohibitionism being reenacted. Prohibition is a strong doctrine with ample support across the globe and is a legacy of multiple forces, including moral and religious dogma and the alliance of the medical establishment with the criminal law enforcement views. Traditionally, certain populations have been persecuted due to their uses of drugs, such as, for example, the Chinese and opium, Mexicans and cannabis, African Americans and cocaine, the Irish and alcohol, and so forth. It has been a way to persecute people. Since you can't persecute people per se, you persecute certain habits and you create these synergies and these stereotypes. Now it seems that on top of the traditional racial tropes, low-class income folks in contemporary U.S. cities are being persecuted and blamed for their use of drugs. And homeless people, as many have said here before, have become a kind of emblem of evil forces that we need to remove for our own protection. The real needs and problems related to health, housing, and labor situation, among so many other issues in Portland, are very challenging. However, it's harder to think of the roots of these problems as grounded in systemic legacies of capitalism, colonization, structural racism, patriarchy, and other forces that oppress all of us. It's much easier to create a scapegoat. That's very classic prohibition, MOU, modus operandus. Sorry, maybe sometimes I invent some words. Forgive me, English not second language. Not sure if everything I say is, I hope you get the general spirit. Again, the pathological and evil drugs, these agents that are here to kind of persecute us like magical beings that have an evil power over us and overturn us and make us do all the bad and wrong things. These figures that become responsible and a catalyst and sort of compress all the frustrations and all the problems that we have as societies. This is happening all over again. It's also so very uncomfortable to have to deal with poverty and such deep social inequalities. Everybody passing through a street and seeing a beggar, homeless people, somebody in need. It's such a bad feeling, isn't it? It's so hard. What do we do? How do we address that? It's best to blame it all on drugs. Drugs have become the scapegoats over and over again to contemporary challenges that are not drug related. And it is easier to try to remove people from the streets, to clean it up, than to have to deal with this problem. As someone that has been studying shamanism, ceremony, religion, and traditional use of sacred plants for 33 years and drinking proudly ayahuasca regularly for 27 years, I consider the regulated access model with no religious or traditional indigenous uses allowed a great injustice and a form of cultural arrogance and racial discrimination. We all know that the regulated model is not enough. It's not for everybody. It will be expensive for some people. It will be, some people have considered that, are distrustful of institutions such as the government or medicine. And as much as it has many advantages and as much as it's good, it's not enough. It can't live on its own. Other uses of drugs, of sacred plants, of plant medicines, of psychedelics, of psychoactive substances have existed since a long time and will continue to exist. And these uses, they can't be criminalized. We all know that this model doesn't work. So again, I am also an advocate for the right to grow substances at home and need for us to think about conservations of plant species and their survival as species. We should not appropriate nature without a care to give back. I support the right to cultivate plant species and fungi. This is a fundamental non-anthropocentric value. We can't put ourselves, human beings, on top of the chain and nature as inanimate and us as beings that have the right to dominate plants, extirpate their lives, kill them, or just consume them without any care for nature itself. Plants and fungi have their own rights, their own beings, then they must be protected. Conservation is fundamental and should go hand in hand with the use of psychedelic plants. I also believe in the power of personal and adult use and systems of self-regulation and community uses. And here I'm going to put my proud anthropologist hat on. There's things that we call cultural and social informal means of controls. These are ways that society have values, protocols, etiquettes, habits, standards, accumulated knowledge on how to use these substances. These substances are not used in a vacuum. This is not a great wild novelty. This has been happening for decades. And I'm not just talking about deep Amazon or the sierras in Mexico, the deserts in Mexico, or jungles in remote developing countries. I'm talking about the United States. I'm talking about the lands of this country. There has been communities using these substances with a lot of care, a lot of respect, a lot of accumulated knowledge. As I say, etiquettes, standards, understandings about the proper ways to use these substances. And so these communities have been self-regulating and have also helped point out bad actors, transgressions, and problematic uses, which also exist. It's not unknown. However, prohibiting all the uses is not a solution for the fewer problematic cases that exist among our communities. And it's in our interest as drug users, as advocates, as passionate representatives and lovers of these traditions, to honor them, to create them, to make them move forward in ways that are integrated, that bring benefits, that help people, that offer health alternatives, that offer spiritual paths, that offer beautiful, pleasant, aesthetic experiences, that offer opportunities of celebration, opportunities of socialization, opportunities of community building, pan-ethnic, pan-global alliances, friendships, camaraderie, so much things that use of drugs can bring to people. And those of us who stand and have been on the forefront of this movement for many years will continue to reaffirm and reaffirm and reaffirm. We reaffirm our rights. We banish prohibition. We banish moral dogma. We banish religion-based, old-century colonial views on evil drugs. We banish old-fashioned psychiatrist views that place these substances as having no therapeutic potentials and power of abuse, and making a whole generalization about all the uses of drugs everywhere by everyone. Prohibition is not the solution. So the psychedelic medicine community should be turning to the Indigenous Reciprocity Initiative of Chacruna and other similar initiatives and other resources to help develop our psychedelic future in ways that we feel represented, included, that promote access, that promote equity, that promote safe and responsible uses. And there is a chance for Portland, as a progressive state and as a recent immigrant to this wild experiment of the United States of America, I feel especially honored to have friends in Portland and to have be a part of a strong and vibrant community in this very progressive state that has a history and has a role in the global economy of this country as a leading force of the nation on drug reform, with the cannabis movement and with the psychedelic movement. So, as we say in Brazil, the dogs are passing, the caravan is passing, the progress is going, and the dogs are going to bark. There are forces that will try to bring us backwards. And it happens. But we get punched and we stand up and we come again. We're not done. We're here again to reaffirm our rights. I want to invite everybody to read Chacruna's guide on the Religious Freedom Restoration Act and Best Practices, which is a comprehensive resource about ways to defend religious rights, to know about your religious rights, but also with your rights come obligations, because we are interested in a movement that we just don't take, we give back. We give back to the people, we give back to the lands, we give back to the plants, we give back to our communities, we give back to ourselves. And the more you service, the more you give back, the more you get in return. So it's an honor to be here. Let's support this ballot, and thank you very much.
Thank you, Bia. Oh, really good to see you. Thank you for your wisdom and your passion and your activism. Okay, so next we have Bryan Kim. Bryan Kim is a 36-year-old yellow American revolutionary from Shingle Springs, California. He is the co-founder and financial director of the People's Housing Project, which is a grassroots organization that provides emergency shelters and support services like trash and needle pickups to houseless camps in Portland. He co-founded and served as the political director for Decriminalize Nature Portland, an organization dedicated to decriminalizing the cultivation and personal ceremonial use of psychedelic plants and fungi for mental health and spiritual growth. The work of his life is to elevate the consciousness of oppressed peoples in such a way that will result in them taking concrete actions to end their oppression. His political inspirations are Huey P. Newton and John Brown. His spiritual inspirations are Miyamoto Musashi and the historical Jesus. Also, is the one person I know of who predicted that the Measure 109 campaign, if it passed, would become a self-protected regulatory system that would prevent decriminalization from ever occurring in the state of Oregon or elsewhere. And I think he will have some really interesting thoughts and reflections to share on this occasion here today. So please welcome to the stage Bryan Kim.
Double click that one. And then which one do I hit to make it do the slide, like to go slides? Oh, bam.
Maybe.
Thought about it.
Thinking about it.
Double click it or like click it there on the thing.
Oh. Not sure.
John, you should just have to hit the present button at the bottom of the screen.
Oh, that one.
Yeah.
That one right there.
And then if he has the slides in PowerPoint, you can select the application.
It's not working.
I did upload this, the one that you emailed me, so I can control it if need be for the stream. But yeah, the people in the audience are going to want to see it as well.
Okay. Let's just try that.
Yeah, that's why it works.
Oh shit! Can everybody hear me? Is it the other one? Is it this? Oh, I unplugged it. I fucked it up by pulling on it. That's happens. Cool. Can we hear? There we go. That's much better. Yeah. Oh shit! It's PowerPoint. Or what is to be done. First of all, I just want to give you all the TLDR of what I'm going to talk about, because I know we're running low on time. We're running a little behind. So I wanted to start just kind of by laying it out. Basically, I'm going to go over 2 affirmations, basically for the general audience and the people who showed up who have not been part of the psychedelic movement before. And then I'm going to give some advice based on history and experience and my time when I was here, because I moved here in 2018 in August to work on the psilocybin therapy initiative back when it was IP12. So I put 4 years of my life into this. I wish it. It's good to see so many people that I haven't seen in a hot minute here. So yeah, basically the long story short, if you're in the general audience, what you should take away from here is that one, the medical model is good. Some people fucking need to have a controlled medical situation in order to feel safe using psilocybin medicine and in order to get the healing benefits from it. That's fundamentally a good thing, and I'm glad we have one. The problem is that medical model without decriminalization is bad. All of the barriers to access that we've been talking about this whole time, all the equity issues that we've been discussing, all of these things we talked about in 2020 when Measure 109 was coming up, and it was why we told people to vote no on it, and here we are. This recriminalization is obviously really bad. This is not fucking good for anybody. I had details I was gonna get into, but everybody else covered it, right? Cool. So basically, if this is your first time at a psychedelic event, that's what you should take away from this. If you've been here for a minute, and as we're moving forward, I really think people should keep in mind some thoughts, because we didn't just end up here with Recrim and 109 and shit. All of this came from somewhere. Somebody paid for and funded these campaigns, and people at the time were telling them that this was going to happen, and they didn't listen. So we should think about that. And I really want to thank, I didn't know Dr. Carter was going to be here, which is dope, because just like they said, just psychedelic use alone is not going to result in the end of oppression. We have to tackle things like capitalism and the housing crisis, right? Cool. Cool. Before I go any further, I want to fucking thank everybody. Everybody clap for PPS for putting on this event. And yeah, thank you to Tabor Space as well. I don't know if any of y'all are here, but thank you. I want to thank John for inviting me. He was kind enough to not censor or read any of the things I said. So if I piss anybody off, it's my fault, not John's. So give it up for John for putting this on, everybody. Cool. And then I would like everybody, we're going to take a 20-second moment of silence. We're going to do a gratitude exercise because everybody here who's like done psychedelics in the past, who has never been to jail fucking for it, we're here because people in the past like fought for us, got fucked up, and pushed to make things happen both legally and illegally. There's people who are in jail right the fuck now for psychedelic use. And there's people, thanks to 110 and its fucking failure, who are going to be in jail again. I also want to take a minute to shout out everybody who fought in resistance to oppression here in the United States, whether that was like gender or race or class-based. So take 20 seconds and close your eyes and bow your head and say thanks that you're not in fucking jail. And take a minute to be grateful for everybody who fought for us to be here and safe. Cool, thanks. History's heavy, y'all. Like shit doesn't just come from nowhere. Like we all ended up in this room because other people fought to put us here. And now that that's done, everybody give yourselves a round of applause for being here. Cause like, it's a fucking Thursday night and you could have been anywhere having fun and you came here to listen to my ass and everybody else talk. So like, that was real nice of you. And cause like, things don't get better if people don't care. And like communities like this are the only chance that this medicine has to avoid ending up another commodity under capitalism. So with all that said, just like I said, affirmation number one, like medical models on their own are fine. Some people need that. I'm not here to like yuck anybody's yum or tell anybody that like you shouldn't go get it from a therapy space if you can afford that. But the reality is that like they reinforce and replicate the pre-existing disparities that our society already suffers from. Whenever anybody talks about like the freedom of use, like a smart mark will never stop asking like freedom for which class? Like if this medicine's only affordable if you have what, $1,000, $2,000, $3,000, it's not really accessible, is it? So affirmation number one is anybody who's talking seriously about equity with these like new ballot initiatives and stuff really needs to think about methods of access to psychedelic medicine that are practically accessible to people who are on fucking food stamps and that are not like, in order to get passed, are not reliant on the whims and largesse of large corporate donors. Affirmation number two. So basically it's like recriminalization is obviously bad. And I want to talk about too, like this is an admission of policy failure. The fact that they are recriminalizing drugs, these people are basically admitting we cannot do anything about the fucking housing crisis. We don't have the willpower to create harm reduction centers where people could actually get into safe use sites. Like we have utterly failed to curb the influence of the law enforcement, the fucking pig lobby on our state. And that is why we are in this position. You know what I'm saying? So intelligent policy would follow the grow, gather, and gift model of decriminalization that an org called Decriminalized Nature has been pushing since 2018. There should be no limits on growth as long as there are no sales. And really, like, we should all be pushing for state funding that, again, does not depend on the largesse of large corporate donors to create, that would create free or sub-$100 access to psilocybin therapy for people in recovery, that would pay for psilocybin facilitator training, and would lower the ridiculous cost associated with Measure 109. Because like, it seems, I was reading in an article, it takes fucking $10,000 per year to run one of those centers. No wonder nobody fucking opens them. That's just the license, yeah, that's just the licensing fee. So like, I don't, hundreds of thousands of dollars. So now we're going to move on to the next part of the talk. So those are the two affirmations. And if like you take nothing else away, take those things away. So why are we here, or what policy fucked this up? So Measure 110, just like Dr. Carter said, it was really nice that they were here because it's like the OHA deliberately drug their feet and did not fucking roll out the money in a timely manner. Decrim was supposed to be associated with an increase in access to recovery centers, and the money didn't show up in time. That seems like deliberate malfeasance to me, because it's like, I hear you when you say like the police said they're like not trained. They didn't fucking care. They spent the whole time lobbying against these things. Like the pigs didn't want this to pass, so they didn't fucking help it happen. Once again, this represents an admission of failure on the housing and substance crisis, because we all know that like there's not a fentanyl crisis, there's a housing crisis, there's a capitalism crisis, there's not an opiate crisis, there's a failure of like our politics and our economy. This isn't like a spiritual crisis, this is an economic crisis that's happening in every major city in this fucking country because people don't have access to fucking housing and healthcare. So and part of the other problem is that like Measure 109 and 110, they were not like really democratically controlled or run by the people. A couple folks with a lot of money paid a lot of money per signature to get those things on the ballot in what turned out to be a failed approach that got recriminalized because you trusted in the state instead of in the working class and the people who showed up here. So like as we're going forward, we can't just depend on people to show up and pay for our movement. We're going to have to pay for and build it ourselves if we want it to remain equitable. So just like a little bit of my history and like who is this jackass who's up here just saying all this, because it's very easy to say, right? So I moved up here to work on the psilocybin therapy bill for Tom and Cherie Eckert when this was still Measure IP12. And the original bill included grow, gather, and gift and protection for individual growers. It became very clear in the first couple months of working with those folks that they were not really interested in building a movement, that they were interested in passing a bill that would legalize a service that the chief petitioners also happen to sell and profit from, which they're still doing. So I quit and helped co-found the Decriminalized Nature Portland chapter. We were funded with no corporate or government money. We got an initiative qualified for the ballot that was Grow, Gather, and Gift. We raised $150,000 and had 9,000 signatures in March of 2020 when COVID hit. So we did not get the signatures to get on the ballot. And we pushed for a no vote on Measure 109, precisely because creating a gated medical model before there were legitimate protections for Grow, Gather, and Gift were going to end us up in exactly this situation. So what is the nonprofit industrial complex, right? It is a nationwide system of 501c3s and 4s that channel dissent with the state and policy. So things like the drug war, dissent gets channeled into the channels that are acceptable to the state. It's a way for large corporations to buy public goodwill. It's a form of advertising. So you're a company who donates money to save the rainforest. You're a company who donates money to take care of homeless youth. Or you're a company that donates money to buy psychedelic policy. The funders of charities and political nonprofits like a petition committee, because that's what you're talking about starting, like they are controlled in a top-down and non-democratic fashion. And like we might agree with their policy choices and the things they're pushing, but we don't have any real control or incentive. So I'm really curious about how this 501c4 is going to work. Because the truth is, like with Measure 109 and 110, like the chief petitioners chose to remove decriminalization in order to secure funding. That's actually really helpful. Thank you, by the way. I forgot to keep my own time. They chose to bundle it with Measure 110, and their biggest funder was offered the chance to circulate our already done citywide DNPDX measure, and they opted not to. So when people like talk about how somebody here said they always wanted to do decriminalization of Grow, Gather, Gift, I don't really think that that's true. So the reason we were no on 109 is a couple like real key, like real simple ideas. No legalization before decriminalization, because like plant medicine's a fucking human right. This isn't a commodity. This is something that was growing here long before humans evolved, and it'll be here long after we fucking die. You know what I mean? People should have the right to access things on the ground. And it's also like creating a legal model creates a legal lobby of people who do not want this to be accessed in any other way except the legal, legitimate way that they fucking control. Point number 2 is we cannot leave our rights in the hands of the state, because you cannot count on the government to preserve access. It was still not federally legal, so the more protection that we had at every level, the better. And like, just look at how bad the board fucked up the one I didn't roll out. I had more points on this, but Dr. Carter really kind of went through it. And And lastly, it's like, once again, like psychedelics alone are not going to free or liberate humanity, y'all. Like they're not here to build any consciousness. It's very easy to get these reified back into the fucking capitalist system. And if that's your bag, that's fine. But don't pretend you're here pushing for human liberation when you're here pushing for your own fucking profit. Like any real liberation has got to be paired with like a class and a race consciousness that's actually going to move the world forward. So just to end, basically, like obviously we need city and statewide protections for psychedelics in general and plant medicines in particular. Recriminalization is a stupid and failed strategy. Strategy advice, build a movement that's people powered and funded like DNPDX was and not like the 109 and 110 campaign. And maybe don't trust the same wealthy capitalists who spent $150,000 on Measure 109 and Measure 110 to run this thing undemocratically again. Like step up and take control if you want to have people's control of this movement. Do not let these fucking guys buy another petition initiative. So lastly, it's just like, these are the questions I want anybody who's serious about moving this movement forward to really think about. So like with any piece of legislation, you should really ask yourself, like, who wrote the language, who paid them to do it, and what, if anything, do they stand to gain? How included were you and the other people in the creation of the language? How can we build a petition that'll create equity of access for all fucking stakeholders? Who controls the current forums, whether that's the Portland Psychedelic Society, this Plant Medicine Healing Alliance, or Decriminalization, and how can they be made more democratic and inclusive on a class and race at every single level, right? And then lastly, like, where are the working class people who make less than $40,000 a year who care about fucking psychedelics, and how do we get more of them into this room?
Oh yeah.
So at the end of the day, thank you all for your time, and I really appreciate everybody letting me share my perspective. I have copies of an essay I wrote about the psychedelic movement if anybody would like some. Cool. Thank you guys. Death to capitalism, power to the people.
All right. Thank you, Bryan. All right. We are nearing the end here. Now we have, next up is Elan Hagens. Yeah. So Elan is a former member of the Equity Subcommittee of the Psilocybin Advisory Board. She's a mycologist with Temptress Truffles, and I believe the owner of Temptress Truffles, and a founder of Fruiting Bodies Collectives, and also a board member at the Equitable Giving Circle. I met Elan initially through her service on the Equity Subcommittee, and here we are now, years later, talking about something even harder than that was, harder loss. So, thank you for being here, Elan.
Thanks for having me. Yeah, like I said, thanks for having me. I was when I was asked, I'm sweating already. When I was asked, I was like, geez, does John know who I am? Like, because, I feel like I'm an outspoken person and have been for a very long time. And there are a lot of familiar, I'm just seeing more faces I know, a lot of familiar faces, Joe, that have been here on this whole journey that not only I have been in, but with you guys, the public. I feel that I am brought here because I am y'all's voice, the normal people's voice. And I don't have anything to lose. I don't have any money to gain. All I have is your opinions, your respect, the people who I was born and raised with. I was born here in Portland, Oregon. I was in many programs for at-risk youth. I have a family who has suffered from drug addiction. I had two nieces who were murdered, or two nieces who were shot, and one died last month because of drug addiction. When I was campaigning for 109, I had 4 siblings who were incarcerated for drugs at this very time. I wouldn't say these things in the past because this is stuff that I'm going to say it, that white people gobble up, that trauma porn that is part of my life and part of my lived experience and what makes me strong and what makes me like be passionate every day. It's not for everybody. And a lot of times it's looked at as, you know, negatively, and it is negative, because otherwise I wouldn't be up here fighting. Otherwise you guys wouldn't be up here fighting. And thank you, Bryan, for all the F-bombs and for all that pig talk, because I was like, what? You know, thank you. Thank you for taking the heat for that. But like I was saying, like, I'm born and raised here in Portland, Oregon. And as somebody who came from a single parent household who didn't have a mom who was like all into psychedelics and taking me places, my experience to the outdoors was from my community members, from my neighbors, from people teaching me what was good and what was bad, other than my mom. It was my community. It was absolutely my community, why I'm standing here right now. And it was because of that community that I became a mycologist, that I was able to love the outdoor, that even without a car, without money, with being like on Section 8 and having food insecurities and home insecurities and all that I was able to somehow push through. And I'm like constantly fighting to push through. And I feel like a lot of us who come from like scarcity and just certain kind of struggles in our lives, that it's going to be with you forever. If I have $1 billion, I'm still going to have this part in me and this lived experience in me. So fast forward, later on in life, I went to college. For a while, I did study public health education, Black studies, and biology. So when Measure 109 was like came and in my ear, I was like, what? This is for me. This is like my time to shine. Because at this time, I'd have business Temptress Truffles, selling wild edibles to the public, taking people on hike, teaching people about outdoors, teaching people how to diversify their outdoors, teaching people about mushrooms, but not openly talking about psychedelics and plant medicine healing. And I wasn't going to talk about it, and I was never going to, because the chances of me being somebody who's going to talk about psychedelics openly and not go to jail in the state of Oregon was non-existent in my world, in my life. And I grew up in a society where Measure 11 existed. 2 strikes, you're out. I may look young, but I'm about to be 40 next week. And so, and Black don't crack, but I'm about to be 40 next week. And I grew up seeing my classmates who, Oregon is not diverse. Like, we know this 2.5% thing is here. Let's not act like it's not here. I'm sick of people acting like, oh, this is wonderful, BIPOC, we're going to help all. You don't know us. You don't know the 2.5%. And that is a big part of it. It's not that we don't want you to know. It's just that's how Oregon has been built. You don't know the 2.5%. And part of not knowing the 2.5% is not knowing what the 2.5% needs. And part of that 2.5% is that the 2.5% takes a lot of the brunt from the community, or a lot of the representatives, the voices for the people who may not be wealthy, who may not be rich, the people who are going to get arrested for just consuming, just for existing. Let's just talk about existing. So fast forward later, 12 years of service, I've been selling wild mushrooms, mushroom hunting, and all that stuff, coming to the farmer's market, doing 4 markets a week, sometimes 5. 108 degrees, I'm at the market, talking to people, seeing some of you. I recognize you from the farmer's market. Like, I see people, and my motivation and the support from Portlanders who love mycology and outdoors was so big and so filling for me, and is why I'm here. And that is what led me to wanting to do some work within Measure 109. Honestly, that's what gave me the confidence that I didn't have, because I have been arrested and I do have mugshots. And those things, I feel like I'm 5 seconds away from walking out this door no matter what and going to jail. That's just how it is. And that's what I've experienced. And that's what I've faced. I'll go to jail. It's fine. It's fine at this point. It's nothing that it doesn't fear. I don't have a fear about it. So when Measure 109 passed, I was so excited. And I met so many people who were like, we're going to sit down with you and we're going to sit around and hear your ideas and hear what you want for the community. And I was like, this is wonderful. Like, to have this kind of support. It was wonderful. Unfortunately, that support changes over time, because a lot of us see stars. We have ego, and sometimes being the one and an only, and this in a town that's kind of in an area that's kind of small, it's kind of more important than public health and community healing, honestly. And I'm trying not to talk too long, but we are talking about this happening during one of the biggest moments in a lot of our lives. We're talking about a mental health crisis. We're talking about post-Floyd. We're talking about the pandemic. We're talking about Trump. We're talking about all these things happening at one time. And then we have Measure 109 passing through there because, yeah, somebody gave some money and made it happen for, some of you guys helped. I took signatures because I really thought that this was going to be something that was community focused, that I would have an input. So when I joined the Health Equity Board subcommittee, I was like, oh my gosh, I'm one of, 30 something people originally. Our first meeting was like, oh, these people, but all these people weren't from Portland. They weren't from Oregon. They weren't us. They weren't us. I'm sorry. And I'm sorry, people, and we have some people here who've been speaking tonight. They're not us. They really are not us. And I'm sick of them being the representatives and the voices for us. Because each location, each group of people have their own unique thing. We have our own unique thing here in Oregon. We aren't stupid. We can grow our own. We're not going to just, take some test and be like, white man, can I here's a $10,000. Can I please have this paper so I can grow my own substrate and take my own? I grew this shit. I grew my substrate. I grew it. Like, this is my own grain. You can't, if you want to go above ground, you ain't getting no taxes off of this. Like, you're paying for it, like, straight up. And there's no reason why everybody shouldn't have a jar like this hidden under their bed and be able to grow their own and provide enough. And the fact that now the only option to safely do it is going to be through a service center and to pay a lot of money. Well, that's okay for the people who've been like gatekeeping it and they don't have the fear and everything, and they don't need to. Because let's just be honest, like, the people who provided the money for this measure, they're all friends with each other. Everybody on the boards, they're all friends with each other. That's why something called a conflict of interest came up during the measure. And if you guys remember, there was actual stop. That's because it's incestual. People are literally sleeping with each other. People are literally getting sexually abused. I've seen women, I've heard of people dying. There's people literally getting abused and being supported by, I'm saying it, our funders and stuff, and people who are up here acting like they are good people. Yes, just because you're smart doesn't mean you're nice. And I'm sick of supporting not nice people just because they're smart. And that's what we're putting forward right now. And what I've dealt with is, I don't even have enough time to talk about it because I've had to be silenced to have my own healing, because what I saw was so disgusting that it took me back at a life where, after losing my mom and my dad and my dog in a year, I thought, oh my gosh, like, this is going to be a community that's going to lift me and help me. We're going to grow together. It was absolute the opposite. It was the absolute fucking opposite. And it's still the opposite. And there's some people in here who know why I've been quiet, and people who here know the severity of some of the things that we've seen and we've dealt with within the measure. And one of the things that we haven't talked about is the ability to even afford to start a business within Measure 109. We just touched it briefly, right? Touched it briefly. So once again, who are even if this $1 million is given for people, for BIPOC people and everybody to have healing and everything, who's getting that? Who's getting that $1 million? It's all staying with each other, you guys. It's all staying in the businesses that have been able to succeed, which are not many of the businesses that have been able to succeed. Because I've thought about it. I've tried. I thought I was going to open a service center. I thought I was going to do all these things. And people know I was doing a training program at one point. And I do not endorse any BIPOC training programs here in Oregon, or I just don't endorse any of these programs because there has been a lot of anti-Blackness openly, and there has been stuff that has been hidden. I have overheard conversations about these training from women I didn't even know, talking about the psychedelic industry and the course they're taking and how anti-Black it was, or how they questioned their person and said, how does this feel? I'm feeling this. And they're like, hey, you go somewhere online and go sit with this group, because that's what's happening. We're talking about dosing ain't being taught either. Like, that's another thing I've heard. There's so many things, and I'm going to keep rambling. Narcissism, clicks, all that. It's why we are here. And when I brought up multiple times about why can't we put in self-usage? Why can't I have my neighbor grow for me? Because we remember, I don't know how old you guys are on average, but there's caregivers for cannabis. I asked, why did we had caregivers for cannabis before all the other steps? Why didn't we even give this one step, one thought about that? Because as we saw with Shroom Shop, which was knocked out by a lot of people and snitched on by a lot of people who work in the measure, I know this for a fact, because a lot of us knew about Shroom Shop opening before it happened. Here's one thing that Shroom Shop taught us. Shroom Shop taught us that we really wanted this. Like, we wanted access. We wanted affordable access. Another thing that Shroom Shop taught us, even though I wouldn't have gone about it that way, and I wish it wasn't Black people involved, trust me on that. I really do. It hurt me. But the thing that there's nobody going to the hospital with overdoses. So, like, this whole thing about, like, safety and stuff, we need to, like, we can drop that conversation. That's gone. And we need to let people grow on their own. And we need to let people actually make money too. Because also, just because 110 was there to do the work that 109 people weren't there to do, doesn't mean there'll still be protection. Because sometimes they want that. They want that so they can still make the money, because there are people coming from out of town. It's not just the people who are getting served are not Oregonians. They're coming from out of town. So it's still not going to serve us in the way that we think, just because things are changed about this. We got to think a little harder. And throughout all the public comments and all the discourse throughout Measure 109, I think the number one thing that I'm going to leave with is that I've been asked so many times, what was the next step? What did the board do with that information for all that public comment period? And what happened to it? Because we heard it. We heard it exhaustively. Like, it's just like on repeat. I felt like it was like on repeat over and over again. What happened? And I could say nothing, because there was times, there was deadlines, there was businesses, there was multi-million-dollar service centers that were supported by our funders, and they still are. And that's more important than community care and community health, unfortunately. It really was evident. And we have people representing themselves as leaders when they actually are students and should stay. I'm a forever student. I am a leader, but I'm a forever student. And we have so many people who took 2 institutional courses, wrote a book about harm reduction, wrote a book about psychedelic training and everything. And now I'm supposed to give that person $10,000 so you give me a paper so I can. No, it doesn't work out. We are smarter than that as Oregonians, and part of our job is to educate our public that what they're doing and what's going on can be done another way. Now, just like Bryan said, if you need that access, I still think it should be there. I still think you should be able to go to a service center if that's what you want. One day I might. I don't know if it becomes affordable. But let's be honest, most of the people who are also working in service centers and also who have moved around in the world freely with drugs, they're still not going to be going into service centers. Like, I don't know anybody who's worked at a service center, operated one, is like, oh, let me sign up for a $3,500 session. No, they're traveling freely all over the world because they can most likely hide, because most likely they'll be cis white males a lot of the times. And you can travel. I learned throughout this, I've learned that you can travel anywhere you want with any amounts of drugs as long as you don't look a certain way. It's disgusting. I like that I have access sometimes. I'm like, oh, this is great. But I'm like, crap, like, these people have no worries. They never have had a worry. They have land to go back. If they fall down, they'll just go back to their parents' land and, be caught, or they can hide out in their town somewhere. But it's in front of our faces, right? It's houselessness and homelessness, and this is in front of our faces. And psychedelics ain't going to heal everything, but it can start, and it can be a tool, or not a tool. It can be a way. It could be something for all of us to connect with. my best connections with psychedelics aren't through psychedelic communities. It's when I'm like at a knitting convention, or I did like a wildlife first aid class for 3 days, and a woman was like, "Oh my gosh, I know you." I'm like, "What?" She's like, "It's from a podcast," and she's like, I'm a facilitator too. And I'm like, "What?" And that's what you need to do. You need to do a wilderness first aid training and stuff like that. Learn how to hold space in that way. You know, that's what needs to happen. So last thing, I promise. I did write notes. Let's stop the gentrification of plant-based medicine, and let's make this make sense. Like, that's it.
Sign me up for your knitting course.
All right. Well, it's been a long evening. We have one more speaker left to go, and we've been throwing a lot of shade on Measure 109, but I don't know. There is definitely a case to be made for Measure 109, and I think there's a lot of us here that had a lot of hope for that program to do really well. And I think we have one of, in my opinion, one of its better kind of stewards here to talk about it, Nate Howard. Nate has served as organizational facilitator for the Plant Medicine Healing Alliance since its inception in 2021. He previously was an initial advisor to the grassroots effort and campaign that became Oregon Ballot Measure 109, helped with Ballot Measure 110, and was the founding member of the Craft Cannabis Alliance and the campaign to create interstate adult use cannabis commerce as a means to accelerate the end of the failed drug war. He co-created and currently serves as Director of Operations for Intertrek, Oregon's first licensed and operating school to train psilocybin facilitators for licensure, and is a founding board member and executive director of the Cherie Eckhart Foundation, a 501c3 nonprofit committed to increasing access to legal psychedelic therapy and services, beginning Oregon's legal psilocybin model. The foundation recently distributed and oversaw $300,000 in needs-based scholarships to a diverse range of 76 fellows who attended over a dozen schools, and nearly every Oregon state licensed and operational psilocybin facilitator training school in the state and country participated. Through the foundation, he co-created the Horizons Northwest Conference in Portland in 2022, which later this year will put on its third annual conference. The foundation is now mainly focused on directly covering the cost of psilocybin services, the cost of therapy for folks with limited financial means, and has come to help underrepresented populations by creating and deploying the Psilocybin Access Fund, which is currently attempting to raise $1 million to give back hundreds of individuals in need, while working with OHSU and others to accelerate the path to broader access insurance coverage for psychedelic therapies within state-regulated models. A leader in Oregon's political community, he served as senior policy advisor to Portland mayor, where he helped develop and pass robust renter protection laws and the city's roadmap to 100% renewable energy. Prior to that work, he served as executive director to Next Up, formerly the Bus Project, youth empowerment and civic engagement nonprofit. He served as the Oregon Senate Finance Director, was chief of staff to Senator Mark Haas, where he helped to develop Oregon Promise, which guarantees 2 free years of college for lower income Oregonians. He's born and raised in Southeast Portland, where he attended the University of Oregon, where he received his BA in city planning, public policy, and management, and he hopes to die in Portland if he's lucky. Please welcome Nate Howard.
John, I'm so sorry that you had to read that long bio, but thank you. Wow, it's 8:35. I'll try to be quick, and maybe I'll spend a moment and see if there's questions. We could do a couple of quick questions, or should we just not do that? But I'll try to be brief. Super honored to be here tonight. Such great speakers, and honored that people decided to hang out
learn about all this and do all this and co-create hopefully a better future in the basement of a church when it's really sunny and nice outside. And everybody who's tuning in from home, if they are, or watches this later. I think what I wanted to offer is something I think is possible, and maybe in the form of an exercise. So you're invited to close your eyes if you want to, or you don't have to close your eyes. But I feel like regardless of the different models and the policies that we've discussed tonight, I do feel in my bones that we will get back to a much more liberated state, regardless of whether it's psychedelic medicine or housing or investing back in social services. And it's not going to be easy and it's not quick, but I believe this version of a future we can co-create and work towards. And in this future, I imagine community gardens where people are able to grow, gift, and gather any entheogenic plant or fungi. A future where if people want to participate in a state-regulated psychedelic model, like what Measure 109 has created, which is far from perfect and hopefully is a first draft and will continue to improve. But if you want to participate in that way, you can do so at no cost in the form of health insurance, Medicaid, Medicare, Oregon Health Plan, private insurers. Not a perfect solution. It's the limit to what I can imagine will happen, but I believe it's coming in the next 5, 10, 15 years. And that is a great expander of access, in my opinion, the same way insurance it took time to develop for chiropractic care and acupuncture and all sorts of services. And it's impossible to mention this without the failed war on drugs, without to mention that the American Medical Association killed the Universal Health Care Bill decades ago because explicitly people in America did not want Black Americans to get the same health care as white Americans. It has to be viewed within this lens. And it's hard for me to imagine a future where we don't get there in the coming decades. So with that said, I am not 100% bought in by any means into what we ultimately got with Measure 110 and what we ultimately got with Measure 109 or where we're at now. And I am 100% bought into where I think we can get to. And that is that people can recreate and heal and work with trained facilitators or do whatever they want with no permission needed from the government to recreate and heal how they desire. And we are not there, and we are in a period of regression because of I think largely focusing on something that really is not based in causation but correlation, wielded for political power, and it led to a regression in the form of the measure we just got. And I believe that will also be short-lived. So, I hope you're all still closing your eyes. The future, I imagine, that we're going to get to is a version of what everyone has spoke to tonight. And I think what the Portland Psychedelic Society is attempting, and what I hope everybody will be involved in and be co-creators of, is a starting place to provide the protections that will allow people to do whatever they want without having to consult the government, without having to pay any money, while also supporting additional frameworks. And the measure that we're talking about in Portland will hopefully be a leapfrog to the rest of the state. And there's more details that hopefully the Portland Psychedelic Society can put on another event. We can share this more. And we have a process where we like to gather more feedback for what the measure actually consists of. So far, it's been hundreds of people that have developed this measure that you can find on the Plant Medicine Alliance website, including a lot of feedback from people in this room. And I feel like, I don't know if everyone feels it, but to me, I just feel this optimism, which I've not always felt, that we can get there. I feel like it's a version of what Anthony spoke to. And it is super hard and really dispiriting to be in this moment where to access psychedelic services, starting with psilocybin, it's totally cost prohibitive. And to see the psychedelic community in particular decades ago warn about the fentanyl epidemic, saying that this year we experienced 4 deaths in the country. We think it could get much worse, and to be where we are now. Am I out of time, by the way? I'll try to stop momentarily. So I feel like the next steps are, in my mind, a much more community-led collaborative effort to get these protections back in Portland and bring them to the rest of the state, and hopefully continue the movement state by state, while not giving up on a far, but from a perfect state-regulated model where people can go get quality care or quality recreation if they choose in a regulated marketplace. And I feel like the big answer to access that I can imagine is getting to health insurance over time. You okay, guys?
Yeah.
Okay. Wow. I'm totally exhausted, by the way. I have a newborn. I've been sleeping every 2 hours. We've been waking up every 2 hours for 2 months now. And I probably should have been asleep like an hour ago. So I'm sorry if I am totally depleted with cotton mouth. I wanted to offer some optimism, but my brain, I think, is malfunctioning. So I'll end there. Is there one question at all about the ballot measure or something as it relates to 110 that is on anyone's mind that's burning? Yeah, please.
Sorry, so in terms of new OPS programs being structured more as a peer support model, instead of what we think of as your traditional therapy practitioners, do you think that I, as a registered psychedelic facilitator, I am attending Soundmind Institute, which you even spoke about recently, would I still be inside the law to be able to hold zero medicine transfer sessions with my clients or groups of clients that are taking a substance elsewhere off-site without my knowledge? As a measure of harm reduction and integration support, I feel like this may be a good way to circumvent the pitfalls of psychedelic capitalism and major overhead investment on brick and mortar spaces, as well as still adhering to the Oregon Health Authority rules, to be able to go seek and encourage clients to cover as a licensed facilitator, while also remaining an educational and harm reduction as a traditional responsibility. Sorry.
No, this is amazing. I'm trying to think about how I can recap this to the audience. Please keep going.
So, yeah, I mean, within the educational program that I'm attending, there are strict requirements about discussing any potential future activity outside of the realm of federal. So do you think there is any avenue within the Measure 110 rollback and 109 regulations that a psychedelic peer support model can exist outside of the purview of the state?
I hope so. I mean, it exists right now, but we need legal protections. And I think that a community-led effort, which is what we're talking about, trying to co-create and conjure here, would get us there. But it absolutely does not exist with full legal protections right now. It exists for people with psychological safety and real safety in the form of their identities. But to Elan's point, that's not everybody. So I think we can get there. But right now it is extremely regimented. And most of what is discussed is about what you can't do. And that is in my opinion, little digression here, but there's so much of what you can't do that doesn't really make sense. And in my opinion, that is a result of political considerations, largely resulting in Measure 91 and 110 being passed almost 50 years into the war on drugs, where a lot of people were scared and were subject to so much propaganda. And so those measures, which began for half a decade, actually in this basement, at least for Measure 109, did try to imagine a future where we could get back to where we once were. And then it was met with essentially the reality of a public that was distrustful because of decades of propaganda. So right now, for some people it exists. It certainly isn't legal. And I hope that we can co-create a new set of rules or allowances that allow people to do whatever they want with these medicines outside of a government regulated framework. And I think it is very clear through public policy, the public policy phenomenon, that when you make something risky or you make something prohibited or illegal, it makes it more risky. I feel that if we do this, and we have a version of it through American Religious Freedom Act, you will start to find that there's more community conversation, there's more community regulation, and you could have the same sort of protections over time that we're hoping will come from Measure 109, because there's less taboos and more ability to discuss, more ability to have peer consultation groups. But to answer your question, which is a version of can I work with these drugs legally right now in community groups outside of the 109 model? Is that too bad of is that a poor encapsulation of the question? The answer is no, not yet. But yeah, hopefully but you know, to Bryan's point and many others, we need to take creation or desire to create a different future matched with the tools that we have right now, which is a process that was created in Oregon in response to a non-responsive legislature, which is the ballot measure process. And ideally, it's funded by people and led by people, and doesn't get moved by special interests, which I think is overstated in terms of what happened with 109 and 110. But there's definitely an element of that, certainly. Wow, I sound like a politician. But that's because I don't want to get into specifics because I don't have enough time. Would be nothing is off limits for me. All right, coming soon.
Excuse me.
Ballot measure. Thank you all.
Can you hear me? Can you just move your mouse because you're frozen on the stream?
Oh, yep.
I think that's why. Thank you.
Wow.
Perfect. Get back to it. Thank you.
That was it. Hopefully that was of some use and interest. Wow, incredible event, John and team. Thank you. Are you coming up? Thanks, man. I'm gonna go to sleep. Volunteer for the Portland Psychedelic Society.
Thank you for being here, everyone. Have a good night.
Good job.